Okay. Hello, Tim. Please introduce yourself to our audience.
Hello, my name is Tim. I'm 20 years old. I live in Germany. I study at the university in Halle right now, and I'm trying to become a lawyer. I'm in my third year right now.
Okay. So, Tim, today's interview is going to be about this app that I'm trying to design, right? And I'm
Yeah.
going to ask you questions about uh, uh, this app, which is about healthcare, providing healthcare services online. So I'm going to ask you questions related to this app and the services that it's going to provide, and what reference you have when it comes to healthcare or using online healthcare services, right?
Okay.
Okay, so how has your health been in the recent times?
Lately, it's been pretty good. I can't complain.
Okay, so do you face any health issues per se, like something that's chronic, or maybe something that you regularly face, which is not chronic, but it's something still bothering you?
Not really. I smoke. That's not good for my lungs, but yeah.
Okay, okay, so it's a habit.
Yeah, it's just a bad habit.
Okay, okay. I mean, we can't really complain. Many of Europeans have a generational habit of like it's a thing that runs in families, right?
Yeah, my mother smokes too.
Yeah. So uh, parents watching parents children grow up thinking to be like them, and they start smoking as well.
Yeah,
But
it's like that. It's just like that.
okay, okay, so what about the amount of people that get lung cancer in Germany? Is there any number that you have in mind?
No, I don't have any number of
But
that.
have you
But
seen anyone get lung
I
cancer?
yeah, my neighbor when I lived at my parents' house, still my neighbor died of it.
Died of it?
That was not nice. Yeah, he died at like 50 years old, and he never smoked.
Okay, okay, that's a very intriguing
It's
fact.
sad. It's sad.
It's sad, but if he never smoked, how did he get lung cancer?
He, he had just bad luck.
Okay, okay. So coming to the topic at hand, so the app that I'm trying to design, right, is about providing healthcare online. So
Yeah.
when you, let's say, when you have some issue with your health, you just open your phone or laptop, maybe, or maybe something else. Like nowadays, we have smartwatches, right? So depending upon the circumstances, you just open that screen up, and you get you book an e-consultation with a doctor, and you get the consultation through the video or audio means, and then you receive your prescriptions for the treatment, etc., etc. So I want to first ask you about how you deal with your health when you have any health issue. So what do you do basically?
Well, usually I go to my doctor and they just ask a couple questions. So that's something that you could basically just do at home and get a prescription online. That would be pretty useful because most of the time you go there, then you have to wait 30 minutes until it's your turn, and then it just takes 10 minutes and then you go.
Okay, so in
Then you
Germany,
get your
you're saying
prescription.
you have these clinics, right, where you have to take, like, you have to wait until your number comes up.
Yeah, basically, they call your name.
Okay, so how much time do you think it takes on average?
To get to the doctor,
Yeah,
to the
yeah, yeah, yeah.
appointment. Um, Depends on, but usually you got to it, it's at least 20 minutes.
Okay, so and
If
how long have you had to wait the most?
The most was when I was in hospital, not at a doctor,
Okay,
because I tore my ACL
okay,
and I had to wait like 2 hours. That was bad.
okay. So, but uh, tearing an ACL is a ligament injury, right? ACL, I think,
Yeah,
is a knee ligament, right?
yeah,
So it requires the attention of a specialist, right?
Yeah, of course. You That's something you can't do online probably because you need surgery.
Yeah, yeah, yeah. So for general physicians, where you have general health issues, you just go to a normal doctor.
Yeah,
And you, by what you're saying, the average wait time is around 20 to 30 minutes.
yeah, 20 to 30 minutes. Depends on how occupied the doctor is right now.
Okay, okay. And how's the healthcare system in Germany, right? I think I have heard that German healthcare is free most of the time.
It's a pretty good system we have. It's You have to have healthcare. It's illegal to not have healthcare. You can get it from the state, but there's also private healthcare where you pay some more money before that, but then you get more benefits like the MRT. I don't know if they call it like that in English, where you get in that big tube and they scan your whole body,
Oh, the
or like
MRIs.
the MRIs. Yeah, that's something they don't usually do to everybody at the hospital because it's just too expensive,
Okay,
and
okay.
they only do this to private clients.
Okay, so you're saying that you have both government-run hospitals and clinics, and then you have these private clinics and hospitals as well.
No, no, no. The clinics are all the same, but it depends on what your insurance is, what your health insurance
Okay,
is.
so the healthcare which you
Uh,
were talking about is something that you have to get, like it's a healthcare card.
yeah,
So you have to get basically like a healthcare card from the state government or the city hall, maybe. Yeah.
not from the insurance company.
Okay,
There
from
are
the insurance company.
multiple healthcare insurance companies here.
So you just have to basically buy some health insurance.
Yeah.
And so,
If you do the private, if you do the free healthcare, it just pays automatically from the taxes you pay when you work a job.
yeah, 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 yeah. So you just get a card for that as well, but it's got but the money that they require for your, like, let's say for healthcare they cut like 10,000, not 10,000, but like some thousand euros from your tax that they collect.
They don't they cut that from the taxes you have to pay, but you don't get an extra bill for that, or you don't notice it. It just happens. Your
Okay.
boss usually has to pay this because he also pays the taxes most of the time when he deposits your salary into your account.
Okay. So
Um,
you say also, I think like the tax is on the higher side in Germany, I think, right? It's like something like 40% or something.
Known if only if you make a lot of money. I think starting at 100,000 a year
Okay.
or a month. I don't really know. Um, then you have to pay a lot of taxes. It goes up to like 50%.
Okay, so it's you're saying like depending upon the income, there are slabs of
Yeah,
the tax brackets. Basically, the more you earn, the more you have to
yeah,
pay taxes.
yeah,
Okay, so you're saying that then you have this government free healthcare, and then you have this private healthcare.
yeah.
And so, how have you, you know, experienced the differences between these both? Like, have you experienced the private healthcare?
Yeah, I have the private insurance from my mother.
Okay,
Um, and when I had my ACL torn, I went to the doctor there, and he said, "Okay, we have to do the MRI." And I went then to the lady at the entrance and said, "I need a appointment for the MRI." And she said, "We don't have that." And I looked at her and I said, "Your doctor just said you have it. I have private insurance." And then she said, "Oh, okay, sit down, wait 30 minutes." And
okay, okay. So,
this
uh,
happens a lot of time. As soon as you say you have private insurance, they treat you like a god, something like that. It's really crazy.
okay, okay. So, I think maybe there are some monetary benefits involved for everyone. So that's why they give
Yeah,
you special treatment, right?
You get really special treatments. You also you get faster to your appointments a lot of times.
Okay.
And
So
they almost always try to prescribe you something, any pills, because they think like, oh, okay, he got some money, he can buy some pills, and I get some more money.
okay,
It's
I
very
see. I see.
capitalistic.
So why did you buy private insurance for your mother?
No, I didn't buy it for my mother. My mother had private insurance and insured me and my two brothers just with her. So we all had this.
Okay, okay, okay. So can you explain the reason behind why she took the private insurance instead of the government run?
Because you have so much more benefits. It's
Okay,
really just like that. You have a lot of benefits. You have to pay a little bit more, but my mother is good, so it's all right. And it's not like that you pay that much money.
okay. So you have to pay outside from your taxes for that private insurance, or does it get cut
Yeah.
from the taxes?
The private insurance you have to pay outside your taxes.
Okay, so you can both, let's say you have a private insurance, right? But if you want to, you can just go to the government one because you already pay
Yeah,
taxes, right? And it's already getting cut from your salary, your tax. So you
exactly.
have, if you buy a private insurance,
But
you have both the options.
yeah, um, but for me, when I started working a job on the side next to my university, I had to change my insurance to the governmental insurance because I earned too much money, so I couldn't be under my mother's name with her insured.
Okay,
But
okay,
that's just because I was in the like family insurance within.
okay, okay. So you're saying that you get a lot of benefits from this private insurance, right? But let's discover this possibility that if you had this luxury, let's say, or the convenience of having healthcare access uh, in your phone or your in your screens like laptops and maybe even a smartwatch, and now you have VR headsets, right? So
Mm,
there's a possibility that we can also implement healthcare services through that headset where you can just, this is just a possibility that we're exploring. Like you can just wear the headset and you can visit an artificial hospital where I don't know if you can get checked through that hospital, but there's a possibility. It's a good possibility. So what do you think about this?
the idea of having like a doctor on your phone, it's pretty nice. It's a pretty good idea. I think it would make a lot of things easier. Um, Especially with this COVID. Okay, COVID is not normal that big of a problem anymore, but it showed us how important hygiene is,
Yeah.
and this can still go on. It's not a problem, and you would save also a lot of time if you can do it at home. You don't have to go out, and even if you're sick, you don't have to go out. Maybe you go to the tram and then infect all the other people, and then the doctor gives you some pills, and you go back and have a lot of contact with other people again. I think it would be really good if you
Okay,
can just do
okay.
it at home.
uh, do they have such thing in Germany right now as we speak?
What?
Is there any services like that where you can get access to doctors in Germany right now?
Mm, Not that I know of.
Okay, okay. So you're saying that there's a benefit. The first benefit being in the times of COVID is something very important, and if it was there in COVID times, it would have reduced the transmission by a lot. Because I
Yeah,
think
for sure.
in Germany the COVID situation was a bit different than it was back in India. So I'm guessing there was
Yeah.
like public places still open, but you just have to wear masks and all that.
Um, yeah, most of the time, but there were times where everything was really just a lockdown. Everything was closed, almost everything,
Okay, yeah, 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 yeah.
except grocery stores. But restaurants were all closed at some point.
Yeah, but you were able to roam around in public freely, right? Or did you have a curfew?
Um, no, we also had like a lockdown. I think at 10 p.m. you couldn't be outside anymore, except you had to walk your dog or had somewhere to go to work, for example. But like it was really a lockdown.
It's after 10 p.m.
Yeah, after 10 p.m. you can't be outside without a reason.
Okay, okay. So there was a curfew there as well. Okay, so the one benefit, I think it's a very important benefit. Germany as a whole would have benefited from this idea, right? I think a lot of
Yeah,
transmission could have been stopped if you just had this uh, healthcare app.
yeah, for sure. I really think that would have helped a
And I
lot.
think most of the times the people had any issues with COVID, they, let's say they went to a doctor. The prescriptions that the doctors gave were usually pills like an antibiotic or something like you know, ibuprofen, paracetamol, some anti-inflammatory drugs, which are easily, you can find them in every house because everyone stocks
Yeah,
them in cases of emergency, right?
yeah. A lot of times, for some of them, you don't even need prescriptions. You can just go to the
Pharmacy.
pharmacy and just buy some of them. And it
Okay.
depends on the doses. You can only buy the low doses of these, and also not from every medicine. But a lot of things you can buy without a prescription.
Yeah, yeah. I mean, if you have the prescription, majority of the times the medicines that the doctors prescribed, like we all knew that if you had COVID, it was majorly up to your immune system to fight it, right? Because it's a virus, and you don't really
Yeah,
have many antiviral medicines. You have most of the time antibiotics, which are for bacterial infections, right? And we also saw that like say in India, a lot of times the doctors were prescribing antibiotics for someone with a COVID case, which was, I don't
mm,
think, really necessary, and
yeah.
people took antibiotics for no reason. And I think in Germany they take antibiotics very seriously, right?
They in Germany a lot of times they take painkillers without a reason. They just got addicted to it.
Okay, but like what's the policy on antibiotics? I heard that doctors usually don't prescribe antibiotics, right?
Um, Only if you are heavily sick, like not if you just have a common cold, they just tell
Yeah, yeah,
you
yeah.
to lay
Like
down
you
and
have
drink a
an
cup of
actual
tea
bacterial
or something
infection.
like that.
Yeah, yeah, yeah.
Yeah.
So for COVID, it was
But
obvious that there was a viral infection in the body. It was not bacterial, but still, doctors in India did prescribe antibiotics to the people as a precaution, but it wasn't really
mm,
necessary because they didn't develop a bacterial infection from the COVID, right?
yeah,
So there was like so much, you know outrageous use of antibiotics in India. And India being like now it's like the most populated country, you can just assume how many antibiotics the Indians consume in that time period.
a lot.
Yeah, so I think if Germany had this uh, platform where they could access healthcare and also get home delivery of the pharmaceuticals like the medicines, what do you think about that?
The home delivery is also a very important thing. It's would have been very good. The problem with COVID was a lot of people were in intensive care because they had to get breathing masks because they couldn't breathe properly. So, but for the ones who didn't have like the real danger from COVID, who survived it easily, it would have helped a lot because what I said, you don't have to go outside, see everybody, sit with a lot of people in a waiting room.
Yeah, 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 yeah. I think in COVID maybe there was also delivery services which were active, right? Maybe they were active in
I w-
Germany too.
we have some delivery services already for pharmaceuticals, but you have to like send your prescription you got from the doctor there, and then they send someone to you. Has to be, of course, a trustworthy guy or woman to do these deliveries because if you deliver a lot of pharmaceuticals, a lot of money is in there.
Okay, so the cost of for pharmaceuticals, I don't think it's any cheaper. I think for the entire continent of Europe, the pharmaceuticals are expensive. Compared to India, you have these companies which make generic pharmaceuticals, where they just take the same ingredients. Let's say, what's the most used medicine for, let's say, a painkiller in Germany?
Probably ibuprofen.
Ibuprofen. Okay, so ibuprofen is, I think, a product of Cipla, maybe. Let's see. Ibuprofen.
I'm not sure.
Yeah, hold on, hold on. Mm, I don't think there's any ibuprofen. Okay, it's owned by, who is this? John Nicholson, or what is this? BASF. Okay, there's some company. There's some big pharmaceutical company, which has patented this ibuprofen, right? So in India, the thing is, even if you have a patent of a medicine, so you have 10 other companies which make the same medicine, but they name it differently and they sell
Mm.
it for a very cheap price. So let's say an ibuprofen costs $10 for like 10 pills. In India, ibuprofen would cost $10, but the alternatives, like the ones that I told you right now, the other companies making the copies of it, they sell it for
Yeah,
like
they
one
just make it
dollar, €1
cheaper.
for 10 pills, which is very
Yeah.
affordable for the Indian consumer. And I think that's one of the reasons why the antibiotics were so widely prescribed and consumed as well, because they were so cheap to get. Like you see people popping an antibiotic pill. Like they're just eating a chocolate. If they, let's say, they feel like, oh, I'm getting a sore, let me take this 650 milligram antibiotic, right? That was the case when it was COVID in India.
Okay.
So I think if if Germany had this application, let's say, where you had, what do you think about this experience, right? You, let's say you get sick, right, and you open this app, and then you book an online consultation, which you get right away because like many of the doctors are signed up on this platform, and so it matches you to any of the doctor that's available at the moment, and so it cuts out the waiting time, right? Which
Yeah.
you said, like, on average is like 20 minutes if you go to a clinic, and you have to consider the traveling time to get to the clinic, which maybe makes
Yeah.
it like 30 to like 2 hours, 30 minutes to 2 hours for some
Exactly.
people. So you get the doctor uh, in minutes, because there's a large amount of doctors active on the app in the day. And so you get on the app, you basically get on a FaceTime call with the doctor, right? You explain to him your problems. You can show him if you have any conditions which are visible. You can just show him on the camera, right? And then you just,
Yeah.
let's say he understands your condition, and then he writes you a prescription. And if you are able to, get that prescription automatic or automatedly, like it's automatically, the prescription is converted into a, the, like, you get like, let's say he prescribes you 4 pills, right? And
Yeah.
he writes it on the app, the prescription, and the app itself, it just creates this cart, which, the pills that the doctor prescribed you, the app automatically adds all the pills in your cart, so you just have to press buy, right?
Yeah. And press buy and delivery.
Yeah, exactly. So what do you think about this idea?
Would be pretty useful for sure. As you said, the travel time comes to the waiting time. It would save a lot of time and make it safer for everybody if you are really sick.
Okay, so and you said you were studying in a university, and I think you or any other people like you or working professional, they're usually short on time, right? So
Yeah,
for people like you, would you prefer this time saving alternative?
definitely, for sure. Just because it would save a lot of time, and as long as the doctors are still professional and good and don't prescribe you anything that you don't need, I would for sure use this.
Okay, okay. And do you see yourself using this service, regularly, or is it something that you would only use in like specific situations?
No, I would probably use it regularly, but thank God I have a good immune system. I don't get sick very much,
Okay, okay.
so I hopefully don't have to use it.
Okay, yeah, obviously. Uh, then, do you see other people using this service? Like, let's say your mother, maybe she's not
Yeah.
as used to technology as you are. So, would you see the demographic that your mother is in, like the old people, the your earlier
Um,
generations?
I think, yeah, they would use it too. Of course, they would need someone to explain it to them how this all works, especially older people. But I think they would still use it. You could just make the design of the app very simple, so it would not be hard to understand.
Okay, okay. Um, then I think obviously because of if this becomes an idea into actuality, there will be a lot of doctors, and so the pricing would be also competitive, right? And
What?
the pricing, so the fees for the doctors or
Yeah,
the prices for the medicines, since if everyone hops onto it, it will have to be competitive for anyone to like it. Like, let's say there are 10 doctors who are offering a consultation for like 10 euros, and then you have another doctor who's offering a consultation for 5 euros. Everyone would choose the doctor with the 5 euros, right?
yeah.
Yeah, but the problem here that I want to explain to you is, what would you do if, you know it might be like, because he's charging less money, he might be someone who's not taking his patients seriously. That can happen. So what would you do if you were
Yeah,
to face certain situations like that?
I don't know. I would probably just do another appointment, and then the next time I rather spend more money than get
Okay,
to the
okay.
bad
But
doctor.
then you have a solution for this problem too, right? Because if we can just give the doctors, uh, so if we show the profiles of the doctors and the fees that they're asking for a consultation, we can also show how many reviews they have gotten. We can
Yeah,
give an option or a feature of reviewing, where any patient or user who has taken a consultation, he can just review the doctor. And then you have this system where you can just sort doctors from the reviews on average
yeah,
from
from
low.
quality.
Hold on, something thing
Um, yeah,
is lagging a bit. Okay, 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 it's fixed now. I think
yeah.
the electricity just went off, but yeah, we got internet at least. So yeah, hold on. Let me just open the windows, man. Okay, so yeah, as I was saying, if we were to give you the feature where you had the power to choose a doctor where you can like sort from the average reviews, so you can just nitpick the one that has the most reviews, and let's say you can also check the prices and see which one attracts you the most. Yeah, what do you think about this feature?
Um, I think that would be a good solution, the review system, because as we were talking, I was thinking everyone would go to the cheap ones, da, da, da. But with the reviews, I think that would be a very good solution. Um, but the other thing is, in Germany, healthcare is basically free, so you don't really have to pay for the doctor's appointment because your insurance pays for it. That would make this basically irrelevant. But
Yeah, it's
you
still
just
there's
like
still
you
this.
have to
Yeah.
you have to put your healthcare security number in the app, of course, and then the doctors get paid this way.
Okay, okay, yeah, yeah, that's a good option that you're suggesting, right? We can just integrate the insurance into your profile where you can just book an appointment, and it's still you still have to pay, but it cuts the amount from your insurance account, not from your own
Yeah,
pocket.
yeah.
Okay, yeah, that's one thing that we can do for this. Another thing that I've wanted to ask you is, even if the, let's say, the pricing factor is taken out, you still have the review thing, right? You still have doctors who might misbehave with their patients, doctors who don't treat their patients correctly.
Mm. Um,
Then I think
yes,
the
I think.
review feature might be very useful, right?
Yeah, of course. For that, the review feature would be very useful so that other patients can know before they go there or before they make the appointment. On the other side, you can also make like report the doctor. Like it's the same in Germany. There's like the doctor. I don't know what it's called, and honestly in English. But it's like
Okay, just say the German
counseling of
word.
all the doctors. It's like der Ärzterat oder die Ärztekammer ist die Ärztekammer. Um, and you can complain about doctors there, but
Okay, okay.
usually only if they break the
Rules.
the basic rules like don't talk about your patients unless he says you can,
Okay.
something like that. But the reviews, I think it's a pretty good idea.
Yeah. So, do you see yourself using this feature to just check the reviews of each doctor?
For sure, I would definitely look at the reviews, read some of them, maybe look at the pricing,
Yeah, but
and
the
just
pricing part is taken care of through the insurance,
yeah,
right? So you still have this, and you
I would
said
just
that some people might not care because they just want a consultation and they don't really care about the quality of the service the doctor provides, the treatment he
yeah
provides. They just want to get some treatment. So, what I'm saying is, would you still be willing, like, be open to this idea of reading reviews for each
yeah
ex?
for sure. Um, because some people like it's just like everywhere. Some doctors are friendlier, some are a bit meaner. It's just like that. That's why I will read the reviews. Also, how professional they are. Maybe someone writes in the reviews, "Oh, he gave me a prescription for something I don't even need, or something that didn't work." Then I would probably not go to that doctor's consulting.
Okay, okay, yeah, that's I think maybe if people start writing reviews and people start reading, it might become a thing, right? So, would you also be willing to write reviews for the treatments that you receive?
Yeah, probably.
Okay, how often do you see yourself writing reviews in other apps?
Other apps, very, very rarely actually. But usually, if I write reviews, only if it's really good or really, really bad. And I don't often write that much. Just like very nice people or very unfriendly people, something like that. Just very
Okay,
short.
okay. And then if you had just given this also this small review option where you could just, after your session ends, with the hold on. Sorry about that. I just had a call, man. I just
Yes.
paused the screen recording, so it's not gonna come in the video. Anyway, I have started the recording again. So back to the question, the answer that you were saying that you would. Oh yeah, yeah, yeah. So I was saying, let's say if your um, video call ends with the doctor, right, and after the consultation, you are given presented with the screen where you just have 5 stars, and you just select
Yeah.
the stars. You don't have to write anything, it's optional if you want to write, but you just select the stars, right? It's still something, but it's easier, it's convenient. Would you be willing
I,
to do that if you have
of
that
course,
option?
of course. I also think a lot of people would use it if it's just after the appointment ends, the call ends, it just pops up. You can also
Yeah,
click it
yeah, yeah.
away if you don't want to review, but if it just pops up and you can rate the doctor, I think a lot of people would use it.
Okay, yeah, that's a good suggestion, thank you for that as well. uh like something like you have when you finish a Uber ride, right?
Mm.
Yeah, so that would be useful for the app. Okay. Then another question that I have for you is, would you prefer this review service, this review feature for the pharmaceutical aspect of the application as well? Because like if you're buying medicine online,
Mm.
you'll also have to consider if they're genuine or if they're fake medicines, I think that might be a concern
Mm.
for Germans.
No, in Germany we don't really have a problem with fake medicine, luckily.
Okay, okay,
Um, but I don't know. I wouldn't do this for the medicine. I don't think they need a review system. A lot of people already know about the medicine they get, and if not, usually the doctor tells you about the medicine and tells you what you need to look out for, like don't drink alcohol with that, or don't move too much because you might get dizzy.
okay,
That
okay.
I don't think that would be necessary.
All right, all right. um Another question that I have, hold on. Yeah, so what do you think about this idea where you can just so we have this, do you use an Android or an iPhone?
I use an iPhone.
Okay, so the iPhone I think has a lens feature like Google Lens, maybe something different,
Um,
where you can just
I don't
point
know
your
it exactly.
camera to the something and it just search whatever is in that image, right?
Yeah, yeah, yeah. Not exactly, but the camera can instantly read QR codes, can scan
Yeah, yeah.
text, anything like that. It's
So
they're pretty advanced.
yeah, so it's I think Google has this feature of reverse image searching, like reverse. It's just
Yeah,
you just take a picture and Google runs some algorithm and it detects whatever objects are in the picture and it shows you Google results for something similar to that or exactly
yeah.
that. So this is basically AR technology, right? And if you had this in your phone, in this app, where you could just scan a body part and you could just, you know, the app automatically detects what's wrong with that particular body part through machine learning and all that.
Like if you have something wrong with your skin.
Yeah, for now let's just talk about skin issues. So if you have
Yeah,
some bruise or some wound and you just scan it to the AR and it shows you that this is something that's happening in your skin, right? And this technology can be further advanced in the future. We're talking about the future, the possibilities. It can also do an MRI in the future. We don't know where science is going to head us. But what do you think about this feature right now being implemented in this app? Would you use it?
mm, no, I would rather consult a doctor.
Okay, okay.
I think that would be better, even if it's also a video call. Then you can just show him what's wrong. You can look at it, and you can also ask her a couple questions like, does it hurt? Does it burn? Does it itch? Something like that.
Okay, okay, yeah, that's also one thing. Maybe the process of doing all that is much complex than just consulting a doctor and just showing to him, right? Is that what you're thinking?
Yeah,
Okay,
that would be a lot easier.
okay, okay. So yeah, that's pretty much all the questions that I have for you. So do you have any opinions that you have to share about this thing?
It's a very good idea, and as I said, with COVID, it would have helped a lot to have this earlier, especially in this much populated country like India. But I think it would help everywhere around the world. It would just be a very good thing to have.
Okay, okay. So yes, thank you for your opinion today, Tim. It was really valuable, and I also had some insights that I could, use to improve the idea even further. So yeah, man, thank you again. That's
No
pretty much
problem.
it.
You're welcome.
Yeah, I will stop the recording now. It was a good interview, man. Thank you.
No problem, my nigga.